All right. So thank you all for joining us today. I'm Danielle McFadden. I'm the president of the Greater Lowell Chamber of Commerce. I want to thank you for joining us for Workplace Safety with Circle Health COVID Experts. This session will be recorded and shared on social media, so we can send it out to anybody who registered in advance. I'd like to thank Circle Health, Jeanne d'Arc Credit Union, and Enterprise Bank, our 2020 Platinum sponsors. We thank them for making events like this one possible. Please let us know your name and contact information in the chat. We welcome a dialogue, but ask that you mute yourself when you're not speaking. And please note that we'll be taking questions at the end of this presentation. Now let me introduce you to our esteemed panel of speakers. We have mary.joe, MD, FACEP, is a board certified emergency medicine physician and is the medical director of Circle Health Urgent Care. Dr. Joe completed her residency in emergency medicine at University of Massachusetts School of Medicine in Worcester, Mass, and received her medical degree from University of Massachusetts Medical School in Worcester, Mass. Dr. Joe's clinical interests are wound management, antibiotic stewardship, and women's health. She is the first ever recipient of the Antibiotic Stewardship Champion Award, given from the College of Urgent Care Medicine in conjunction with the Urgent Care Association and the Urgent Care Foundation. Tracie.mcpadden, MSN, RN, CEN, CPEN, has worked in emergency services at Lowell General Hospital for 20 years and serves as the Director of Emergency Services for Lowell General Hospital. In this role, she manages operations for the emergency departments at both the Main and Saints campuses. She is also the Director of Circle Health Urgent Care, having successfully opened and enhanced services at 4 urgent care locations in Billerica, Tewksbury, Lowell, and Westford over the past 6 years. Kelly.Zapata has been helping area businesses, first responders, schools, and more manage the health of employees for over 8 years. As manager of Circle Health Occupational Medicine Services, Kelly helps employers with the necessary screening and works exams required by the state, and has recently developed new programming to help employers navigate the new safety guidelines with COVID-19. Thank you all for being here.
Thank you for having us.
Thank you. I'm going to go ahead and bring up our screen now. Let me see. Will you just let me know if you can see the screen? Yes.
Yes.
And if you could let me know if it's moving forward when I get to that. Okay. That slide move forward for us.
Looks. Do you mean move forward to the next slide?
Yeah.
No, I'm not seeing the slide advance.
Let's see.
There we go.
Yeah. Okay. All right. So we'll run it just like this so we don't have any problems. Well, thank you so much for all of you for welcoming us here. We're so happy to give you just some feedback on some of the work that we've been doing here at Circle Health and Lowell General Hospital. And just to give you a quick introduction to our urgent care sites, we have urgent care sites in Billerica, Dracut, Tewksbury, and Westford. Our urgent care sites are accredited by the Urgent Care Association of America. We are a part of the integrated medical health system at Lowell General Hospital, and we are also accredited for our occupational medicine program through the Urgent Care Association of America. We provide services for basic illness and injury at our urgent care sites. We also provide occupational medicine, and we have travel medicine services. Some of our travel medicine services recently have begun to include attestation with COVID testing for those New England people that want to go to Maine on vacation and they have to have proof that they had a negative COVID test. So we are offering that, as well as a full range of other COVID tests for people who are symptomatic or who have had contact with a known or suspected person with COVID-19. Dr. Joe, would you like to take over?
Sure. So pre-pandemic, we have an OCMED
clinic at all 4 of our sites, and services that we provide include pre-employment physicals, as well as drug and alcohol testing, respirator clearance, initial and subsequent care of workplace injuries. And with this, even if our OCMED clinic is not open, we see the initial eval during our hours, which are 7 days a week, 8 to 8. We also do pulmonary function testing, DOT physicals, audiograms, and we support businesses with a customized approach to meet their unique needs. So coronaviruses are a large family of viruses that usually cause mild to moderate upper respiratory tract illnesses like the common cold. However, in the past 2 decades, 3 new coronaviruses have emerged from animal reservoirs and can cause serious and widespread illness and death. While there are hundreds of coronaviruses, most of which circulate among animals, there are only 7 that can sicken people. 4 of them cause very mild symptoms, and most of us have immunity to them. The newest virus, named COVID-19, because it was identified in late 2019, is brand new to the human species. That means that the majority of humans, including those of us in this meeting, have no immunity built up to fight off this virus. Unless you've already had the virus, then you may have antibodies. But we don't know whether that means you are not susceptible to getting it a second time. Until we identify a safe and effective vaccine or treatment, we must use methods to slow down the transmission of the virus in our communities. And this is where, the challenge comes to you employers to figure out how to reopen or continue to keep your businesses open in a safe manner. I know it's important to open up your businesses, but we want to avoid any further outbreaks, as many of you have seen on the news. There is no cure for the virus, so the most important thing that we can do is prevent spread. If we can't quarantine, then we need to minimize the spread with hygiene, masking, and distancing. I know there's a lot of talking. You guys probably have a lot of questions, and we'll open it up later, but if you have staff who have symptoms or have been exposed, we do offer testing. Currently, we're offering the nasal PCR testing for people who have either had symptoms or been exposed to people who were tested positive. And it measures the secretion of the virus or viral proteins that are not live. And that means you could have a falsely positive test even if you're retesting an employee or somebody who previously did test positive. So this is where we can help you and help people in the community determine when it's safe for someone to return to work if they were previously infected. Antibody testing is also available, but it's not clear what the significance of that is, and it's not recommended for determining if someone's infected or contagious. It really tells us if someone's been in contact with the virus and has antibodies. It's only useful if it's been over 2 weeks since the person had symptoms and that person has recovered. All right, Tracy, you want to do the next slide?
Did my slide move forward? Can you see the new slide with reopening Massachusetts?
Yep.
Okay, perfect. So I wanted to just I'm sure that you all are aware of this online resource, but Reopening Massachusetts is Governor Baker and the Baker-Polito administration have put forth this online tool that you can use that sort of outlines their phases of opening businesses. And it has a lot of really great information, and we have opened it many, many, many times to look at the recommendations and find links for resources. So I wanted to highlight that. This outlines not only which businesses can open in which phase, but what specific things you must do for each specific type of business, whether it's a restaurant or a daycare or some type of hair salon, and whatever it might be, it gives you the very specific details for your business. And, businesses need to have a process to ensure that they have a safe return to their working environment. And as Dr. Joe said, if you have only 10 employees and all 10 of them get exposed or get sick, what is going to happen to your business for the next 4 weeks or 6 weeks until you get everybody healthy and back? So it's really important to have solutions that will minimize the transmission of the virus in the workplace. In addition, none of us want to be the business that's on the local news station as the source of spread of the virus. And so it's another reason to definitely be sure you have really strong controls, strong policies in place, and that everybody that works with you understands them and follows them. And so the Baker-Polito administration has required us to have administrative controls, which are policies, environmental controls, which are physical space things that you do to try to separate folks and eliminate people from congregating in settings altogether. Our employees must have access to personal protective equipment, and that is unique and specific to your job or your business. They have to have access to hand hygiene, and they have to have, like I said, those unique business specifications that you have to provide an attestation for. The attestation form has to be completed with the plan. It does not have to be submitted, but you do have to be prepared for an inspection should you have one. And so administrative controls that you could consider are like a screening process. This is a must. We do a screening process that we're moving to an electronic process so that all employees must list their symptoms each day before they arrive to work, and it electronically captures that information. And it tells the employee, you're safe to come to work, or you should stay home and contact occupational medicine if you have a fever or a cough. So every business should have a process where they are screening their employees prior to them coming to work. You should have a policy for sick time for your employees and their family. If your employee has a sick family member at home with COVID, it would probably behoove you to have them stay home and take care of that employee, or and take care of that family member. But you should be thinking about that in advance so you have a solid policy on it. You want to have a policy of what you're going to do if an employee gets sick while they're at work. They suddenly don't feel good, they may have a fever. What are you going to do to clean your environment, and how are you going to manage shutting that space down to be sure that you're able to allow airflow to reduce any of the virus that might be there. Other administrative control things are, can you stagger the times that people are coming in to start their work day so you don't have clumps of people all punching in at a time clock at the same time? Can you stagger how lunch breaks are being done so that you can eliminate clumps of people being in the break room? When I show you the next picture here, and just tell me, we move to the next slide, environmental controls. I want to be sure you can see it.
Yep.
Yes. So the environmental controls, these are the actual physical spaces that you can change to try to reduce the transmission. So this picture on the left-hand side is a picture of one of our break rooms here within the Circle Health system. What we did was move the table 6 feet apart, and we put one chair at them. We have a universal basal personal protective equipment standard for all employees that they must wear a mask at all times when they are out and about in the organization. Here within my office, I can take my mask off, but I'm well more than 6 feet away from the next person. We also know that everybody's going to take their mask off to eat their lunch. And so if you put 4 employees together at a table, you're now no longer having social distancing and they're not wearing their mask. So keep in mind things like that. And then the second picture is a picture of the plexiglass, which I'm sure you've all seen in many, many places. We have lots of tape on the floor that outlines where 6 feet is between each customer in line, either to check in or to at Dunkin' Donuts to be able to get their coffee, things like that. These are just environmental things you can do to try to reduce the transmission. One of the standards that Reopening Massachusetts also has are these safety standard signs. We have a wonderful marketing department here at Lowell General Hospital who has made all of our signs standardized. And so here's some examples of it. But a baseline sign that you have to have is to make sure that employees know how to wash their hands and make sure they know they have to wear the mask while they're in your business. And so our signs are all standardized, but you can go right onto that Reopening Massachusetts website and you can get copies of signs that are done in all different languages if you need them. So there's lots of resources there. And since we went live with our post-pandemic services, we recognized and realized that we needed to offer some services to our businesses and to our community that would help them manage the transition into COVID. And if you think back, the first case here in the United States was January 22nd that was reported. And our first cases here in the Lowell area weren't until the beginning of March. And so very, very quickly our world has changed, and we are all trying to struggle to kind of keep up with it. But we very quickly have enacted COVID-19 testing that's available at all 4 of our clinics. You can call and get a test either for yourself or your employee or their family members. We can offer return to work clearance. We have telemedicine visits available that employee could do that from home, or where they can come in and be seen by a physician. We also have consultative services that Dr. Joe or one of her team members could meet with a business and provide consultative services for them to interpret the CDC guidelines so that they can write their own policies on how they will allow employees to come back to work. Just as we talked earlier, administrative controls are policies that you want to have in effect to say who has to stay out and how long they have to stay out for. We also have daily screening options. We can either offer a person to come and be your daily screener, or we can help set you up with forms and give you some education on how to do that daily screening. We offer N95 respirator mask fitting for any businesses that require that. We obviously can take care of your sick or injured employees, and we can offer some training on health and wellness for your employees during this pandemic time. They need to stay healthy when they're at work. They also need to stay healthy when they're at home so that they can come to work and help you run your business. And I really just have to highlight the mental health strategies for employees, and I think businesses should definitely be thinking about this. Over the last 6 months, we have had a tremendous change in our culture, and we are now all a little bit nervous and a little bit scared, and everybody is managing extra stressors that we didn't have back in January, dealing with working at home and having your adult son walk in front of the camera who might be coming out of the pool, or you know, just funny things that have happened, but it's all additional stress. We don't have as much childcare. We are all worried that we might get sick and bring that home to our family. There's lots of things, and so it's really important for you to acknowledge that, identify that, and see if you can speak about it with your employees. If you have an EAP, make sure that they are aware of that. And if you're struggling with any particular resources, we do have lots of resources that we can help you that are low-cost online resources that you can help support your employees with. And I would be remiss if I didn't share this information with you. We have really wanted to get out the message to our community that you are safe to come to Circle Health and Lowell General Hospital. We have extremely strong infection prevention measures that are in place. As I said, we have PPE. When you arrive to any of our sites, you will be meted by a greeter who will ask you to do hand hygiene and put on a mask. And that way we know that everybody in our buildings have a mask on, and we are reducing the risk of transmission. We also have done a lot of work to reduce the waiting in waiting rooms so that we don't have large groups of congregate people in waiting rooms. If you go to any of our waiting rooms now and you haven't been there since before March, you will see that we have way less chairs than we ever had. They are spaced out 6 feet apart from each other, and there are very few. We do not want large groups of people waiting in a room together. We have done things like remote registration. We can do that with you online or from your car, so you don't have to stand in line in a group of people. We have initiated telemedicine so that you can have services from the comfort of your home. And again, all of our employees are screened before they come to work. And then we really thought that we would sort of hand this over to Kelly, who manages a lot of questions from our OCMED clients on how to manage their particular businesses, and thought that this might be the most helpful application of the information that we've been dealing with. So I'll hand this to Kelly.
Thank you, Tracy.
You're welcome.
All right. Thank you, everyone, for coming in and participating in this seminar. So one of the most common questions is about gloves. I personally see a lot of people in the grocery store wearing gloves. So I just feel like a lot of employers and a lot of people just need the education on when is it safe to use them and when it shouldn't be used. So I just want to briefly state gloves are only meant to be used while cleaning, caring for a sick family member or a patient. And I know in a lot of the restaurant businesses, they use them for food prepping. So those are okay scenarios to actually wear gloves. Now, gloves will not fully protect you from COVID outside of these scenarios. For instance, again, the grocery shopping, the thing with gloves is it does help what's called cross-contamination. So we want to make sure that everyone's aware of that. So the best method for you to protect yourself and others is to hand wash. So again, for 20 seconds, or use a alcohol-based hand sanitizer, which should be at least 60% alcohol concentration or more. So we're going to talk a little bit more about the cross-contamination. Again, gloves are only meant to be used for one time only. So cross-contamination, what is it? It's the process of which bacteria or other microorganisms are unintentionally transferred from one place to another. So hence why it's only one-time use. You are at the grocery store, you want to grab a couple of fruits or a couple of produce, but then you're also touching meat products and other stuff. So whatever might be on that surface is unintentionally being transferred to another surface. So if you can, do not wear gloves. Just make sure you have hand sanitizer available. Next, another question that we get a lot of question is how to properly use your face mask. So I'm actually going to do a demonstration on how to properly use either your cloth or your medical mask. So if you are aware, before handling the actual mask, you want to make sure you either hand sanitize or wash your hands for the 20 seconds. And you always want to handle your mask by the earpiece, so the elastic part of your mask. So the mask should be worn with the collar side to the front, and usually the white part of it, I'm not sure if you can see, it's not really clear, but the white part of the mask should be towards your face. So the proper way of actually handling a mask should be just like this. You want to grab the elastics, place it on your face, loop around your ears, and with 2 fingers, you want to pinch at the nose and then pull over your chin. You also want to make sure that there's no gaps on your face. Again, you want to make sure that your face is fully protected. Now, for taking it off, it's the similar process. You pull by the strings, and for medical mask, you want to make sure you discard them. You do not want to reuse them. So you can throw those out. Now, we have the cloth facial masks. So ideally, you want to either make or buy one that's a 3-ply or a 3-layer mask. They should be, the front layer should be water resistant, the inner layer should be a filter, and the back should be water absorbent. So that's exactly what you should be looking for on a cloth mask. Again, same process. You want to hand sanitize. You grab your mask, you want to inspect it, make sure that there's nothing wrong with it. Make sure it's not soiled or wet. Same process, you place it over your face, loops around the ear, and then you pull and make sure it's nice and snug on your face. You don't want any actual gaps between your face and the mask. So again, you remove it, take it off. Now for face masks, because they can be reused, you want to make sure that you wash them with hot water and soap once a day. Now, if you do need to reuse them, you can use either a plastic resealable bag or ideally a paper bag, just because we have learned in the medical field that COVID doesn't really like paper. It tends to stick more on plastic. So once you take off your mask and properly put it away, you want to make sure, again, you hand sanitize for 20 seconds. Okay.
Kelly, if I could just add on to that, what we consider is that front of that face mask is contaminated. That would be where other particles might be. So if you're taking your mask on and off, maybe you could demonstrate the Dunkin' Donuts flip down under your chin that we see.
Sure. So we see a lot of patients and a lot of people in the grocery store also doing this. Oh yes, hi, I would like a coffee, please. Whoop. So we want to make sure that this is always protecting your face. Again, this is for your protection and protection of others. Try not to touch the front. All of the germs, all of the microorganisms are here. Hence why we want to make sure when you remove it and put it on, you use your earpiece, your elastic band. Any questions on that so far? All right, moving on. So we do have another, one of our other topics is my employee is sick. What should I do? So employees who have symptoms when they arrive at work or become sick during the day should be immediately separated from other employees and sent home. Employees who develop the symptoms outside of the work, they should notify their supervisor and stay home and follow the steps on the CDC website.
And so we would be able to offer services if the business had any questions about that. We can have them reach out to us and give us a call, and we can provide them some recommendations. I don't know if Dr. Joe, if you want to talk any more about the, how to manage this employee.
Right. I mean, if the employee is feeling sick, there's no way for you at work to determine whether they have COVID or not. So in order to protect other people in the workplace, customers, it's better to send that person home and have that person seek medical attention. They can call our clinic, come in. We can, if they're not severely sick and they just report that someone at home or they've been exposed to someone with COVID, we can set them up for, the drive-up testing. And we're available to answer questions if you want to call us.
When should an employee suspected or confirmed to have COVID return to work? So sick employees should follow the steps again on the CDC website. They should not return to work until they meet the criteria to discontinue the home isolation and have consulted with a healthcare provider or a state local health department.
So, and we would add to this, this is the complexity, I think, for businesses, because it really matters on what kind of employee you have. If you have a healthcare employee, there are different standards than a regular business. And this is where our team certainly can assist you to make that determination. Employees who are sick must be out for at least 10 days from the onset of their illness. Employees who are contact or potentially have contact with a sick person have to be out for 14 days. But we certainly can help businesses sort of walk through this if they need support with that. I don't know if you have anything else to add on that either, Dr. Joe.
No, that's the crux of it, is they have to be out for at least 10 to 14 days if they've been exposed or showing any signs or symptoms of COVID. And then there are guidelines that we use for when they can return to work. Some are test-based, some are non-test-based. So yeah, we can provide guidance.
Again, yep. Okay.
Sorry.
It's okay. All right. So if an employee has been exposed, but they're not showing symptoms, should they be allowed to come to work? So again, we want to make sure they stay home and isolate for 14 days. They should self-monitor for symptoms during this time and notify their supervisor if they start to present the symptoms start to present. Should I be screening employees for COVID symptoms prior to coming to work? Well, it is a great option to try to help mitigate the spread. So some of the most popular methods that we probably already seen is the temperature checks and the symptom questionnaires. That's also something that we can also help out distribute if you need to. And as Tracy said, as our post-COVID services, is we can have somebody come over and help you with that or guide you or train you on that. Okay, next slide. Oh, my employees need to be tested. Where can I schedule them for testing? So this is where Circle Health Urgent Care and Occupational Medicine come in. So we have currently testing available at all 4 locations. So we have also a convenient drive-mobile testing site that will be available soon at our Tewksbury Urgent Care. So you may call any of the 4 locations or call the Occupational Medicine department if you have any more questions, but we can definitely help you with the COVID situation for testing employees. Can I get all of my employees tested for COVID before they start working? Well, the testing, if it's performed in advance between the 24 and 48 hours prior to the start of employment, that's good. But if it's out of that frame, it's not really going to be an accurate test. So we do suggest if you have somebody that needs to start, let's say, Friday or Saturday. We can definitely get them tested as long as it's within that time frame. Dr. Joe, you want to add something on that, or?
Yeah, because people can have been exposed and may not test positive initially. So if you're testing too soon, it may be falsely negative. So you want to wait. And that's why they say symptoms may not present for 2 to 10 days after you've been exposed to someone with COVID. So if you're hiring someone, they're not starting for 3 weeks and you test them today, you know, they could come into contact with someone with COVID, you know, 2 or 3 days before they start work, and that test is no longer valid. It's not accurate. So that person still could have COVID. Yet you don't want to test too close to the start of the workday of when their start date is either. So we'd probably recommend 48 hours before they have to start employment to have them come in 48 to 72 hours to get the test done.
Which is the same thing that we're doing within the hospital for anyone that's pre-procedure. And some of you may be finding that, like, if you go to the dentist, they're going to ask you to have a pre-procedure test done before you come and get dental work done. And we're all doing that about 48 hours prior to the procedure.
Thank you. If I shut down my facility as a result of COVID, of a COVID outbreak, what is the recommended process that in order to resume business hours? So in most cases, you will not have to shut down any facilities, but you are required to close off at least that portion where the prolonged employee was. So the current steps that you should take if this were to occur is to wait 24 hours before cleaning and disinfecting the site. This is going to minimize the exposure to anyone who will be cleaning and disinfecting. If the 24 hours is not feasible, you wait as long as possible. You want to make sure you increase your air circulation in that area. You want to clean dirty surfaces with soap and water before disinfecting them. You should use the disinfectants that meet the EPA criteria for this type of virus and wear the appropriate PPE. You should also determine which employee may have been exposed and follow the public health recommendations for community-related exposures. Operations can resume as soon as the cleaning and disinfecting process is complete. More information on this is on the CDC website as well. All right, thank you. Any questions?
Kelly, just in terms of the COVID testing, so I'm not sure if you mentioned this already, but that is done by appointment, correct? The preference would be that a business would call versus just sending their employee over. I know we stagger those just to, again, for social distancing, but could you just maybe clarify that?
Sure, yeah. So again, if you have an employee that is in need of the COVID testing because they do have symptoms, you want to contact one of the urgent cares or the occupational medicine program itself to schedule an appointment.
I guess I would also, okay, I'm sorry, go ahead.
I was just gonna see if anybody else had questions, but.
Yeah, I guess we would also like to hear from this community, like, what are the other big worries that you have that we might be able to support you with? I know that this is new, and in the last 4 weeks, people are opening. What are the needs that you might have that we can help with you?
Quiet group today. I mean, I know that what we're hearing from our members is that just the PPE, how to get it. And then I'm curious to know what the preference would be in terms of masks. Is it the disposable medical masks? I prefer it over a cloth mask. What would you recommend?
I believe that the CDC has guidelines on that for you. So if you're in the medical profession, you have to have medical grade, but that is not required in other settings. It simply just needs to be a mask. And there is a website that is available on the Reopening Massachusetts. It provides you some PPE and cleaning resources where you can get those from local businesses around, here in Massachusetts.
Mm-hmm. Thank you. And I can put some of that information right now in the chat as well, because we have that on our website.
Okay.
So I have a quick question. I'm curious to know. I'm just thinking of it from a business perspective. I'm director of business development for the town of Chelmsford, and our Crossroads area is a very large business park. It's mostly large employers, and I'm not sure that they would really be aware that they could seek these types of services from you. I think when they hear about Lowell General or Circle Health and things like that, they're not necessarily understanding that you would provide these types of services aside from individual medical care for people. And if I didn't meet you a few times ago, I'm not sure if I would be aware that you'd be offering this type of service for occupational and workforce development type of help. So I think I have offered some partnership, but have you thought about doing some direct outreach? Or, I know the Crossroads is a concentration of businesses out there that you could probably do a blanket mailing or some type of approach. I am still forming a business association this year, so could be more partnership opportunities going forward. But in general, for the products that you are offering and services providing for the region, maybe think about a way to do more promotion or, something more of a, proactive approach.
Yeah, that's good feedback. We appreciate that. Our number one goal is to reduce the transmission of this virus, and we consider ourselves as a resource for the community, and we plan to see that through to the end of this pandemic, which we know there will be an end. There will be a vaccine and there will be a treatment, but it's getting from here to there that we're all going to have to work together to do. And so we do plan to be here with you to help manage that. So we will work to try to spread that word a little bit more, and I appreciate your help. You've been great.
Yeah, excellent. Contact me anytime. It doesn't have to be an arduous task. Could simply be something through an email blast. And Jen, we all know who the expert is on that. In the upper left-hand corner here of the screen. So.
I was actually just thinking that we've been pushing out resources, and I think we could be doing a better job at really telling the community about the services that you have to offer, and we'd love to put a blurb like right at the top of our resources tab on our website to let businesses know it's available.
Okay.
And I personally love the urgent care option. Even before all this happened with 3 young children, if given the choice to go anywhere, I'm like, let's go to urgent care. It's great service, beautiful facilities. So I can't say enough about the urgent care at Circle Health.
Thank you very much.
Thank you.
Well, our contact information is at the end of this presentation, just if questions do come up after the fact that we could, can I share that screen?
Yes, you should be able to share that again. Let me make sure. Yeah.
So here's our contact information. If anyone needs to email us, you certainly can also call us at any of the urgent cares. Circle-health.org is our website that you can get on and see the locations and the phone numbers for our urgent cares, but these are our direct emails if you have questions. And we
had more people register that actually showed up. So what we're going to do is we'll send the recording, but also the contact information and maybe even the presentation, so that everybody has that information as well, because this was really useful. I feel like it's been information overload, and the way that it was presented today is manageable, easy to digest, and it makes it more feasible for people who are overwhelmed to come up with an action plan for their employees. So we appreciate that.
Yeah. Well, it's definitely been a journey, and we've had to figure that out March 5th when we had to start the process. And so we've had to create our own action plans. And so we do have some experience doing it because we've been, we've had employees on site the entire time, obviously taking care of patients here, both in the urgent care and the hospital.
And I'm noticing that we have participants on this Zoom that are involved with child care, some that are involved with elder care. Is there anything specific you could touch upon in terms of if you have young children and or if you're caring for an elderly loved one?
Well, I would say that I know that there are very specific guidelines that you have to do for childcare settings, and I know that you can find those on the Reopening Massachusetts site. And if we can spread anything to you, it is that cross-contamination topic. So if I touch the desk or the computer that my coworkers have been touching, and then I touch my face, I now have contaminated myself. And that is the same with our little people. So if you are taking care of a child, you definitely want, you wipe a nose of somebody, you have to do hand hygiene before you touch anything else. You're either going to contaminate yourself or the surfaces that the next person is going to touch. Yeah.
Thank you. Any other questions or comments? Oh, we know how busy you are, and you probably haven't slept since February. So we really appreciate you taking the time to share this really useful, tactical information. We will be sharing it. We will do a better job of spreading the word about all that Circle Health has to offer, because it's truly incredible what you've been doing. You've always been incredible for this community, but now you're just making us so proud and making everybody shine.
And if I could just add, the support that we've received from the community has been just unbelievably amazing. It, you know, we've had donations of food and just messages of thanks, and it really has meant a lot to us as we've continued to get through this, you know, unprecedented, none of us have ever had to do in our career, because it's a once in a 100 years that we're managing this.
Any other closing remarks? Well, thank you again. Thank you to everybody for taking the time to hop on this presentation. Thank you to our presenters, and we want to thank Circle Health. You are a 2020 Platinum sponsor of the Chamber and make events like this possible. So thank you everybody for joining us today, and I'm sure we'll all be in touch soon. Have a great day, everyone. Thank you.
Bye.
Bye. Thank you.